Thank you, Dr. Deepshikha, for giving this opportunity. It was a very excellent and enlightening deliberation by both the speaker, Dr. Sangeeta Gupta and Dr. RENU CHAWLA, that is on the POCSO Act. And just to mention that it is very shocking to know that almost 1 in 5 female girl and almost 1 in 13 boys are usually sexually abused at the age below that 17 years, and almost 120 million of the young girls and adolescents below 20 years are usually had experienced some type of the sexual abuse in their lifetime. And the most important to know out of all these key, the boys are equally sexually abused equal to the female also. After the COVID period, there is a rampant increase in the pornography cases also, and this may be because of the interest in the nudity and the part of the normal sexual curiosity of the children, and also because of the unscientific dirty magazines. So it has now, the pornography has become a increasing business, and the effect of all these are that the juvenile crimes are increasing and almost increased to the 3 times, and almost 50% of the crimes with the against the children are related to the sexual offenses. Now in to know all about this POCSO Act, to cover up and all, to protect all this POCSO Act was enacted on the 14th November 2012, and it is very heartening to know that most of us are either unaware or we are ignorant or misunderstood this POCSO Act, especially we the OBGY people. Though this act is important for all the specialty of the medical field, whether they belong to the private or the public sector. This act is also a very important step forward to protect the child from the various sexual offenses, and it provides also a safe, comprehensive health care. And out of all the various acts, this is the most neglected, but though it is a very child-friendly act. And it just goes without saying that the ignorance of the law is not an excuse. And it's important for all of us to know and to understand that this law has a very strict guidelines with the very strict punishment, which are graded according to the offenses. And the various, still there are very pitfalls of the law, and the practical aspect, how to deal with such type of the cases under the POCSO Act when comes to our clinic or into the hospital. There are 2 main objective part of this act. One is to protect the children, and the other is, other important aspect, the most important aspect is to protect ourselves with the legal implication of this law. And today in this panel, we have very learned panelists who have a vast experience in dealing with such type of the cases. And this session is going to be very interesting and very interactive, because all the cases which has been selected in this discussion are real case scenario. And I'm very hopeful that with the experience, everyone who is attending this meeting will go home with the carry home message how to deal practically such cases. So can I have the slide, please? So this already has been mentioned.
Salient features ho gaye.
This is the case 1.
The case 1 is for Dr. Meenakshi. She is a 12 years old girl with the history of sexual assault by a boy who is 20 years old, and they were in the love affair, and since last 1.5 years. And the intercourse was with the consent of the victim. She was a student of the 5th class. She ran away with the assailant and married in a temple. Next. On examination, She was well oriented to the time, place, and person. Vitals were stable. There were no injury marks, no injuries seen on the genitalia. But on per abdominal examination, she was a full-term pregnancy with cephalic presentation, and the fetal heart rate was there. She was admitted in the ward to get all the investigation of the ANC, and the ultrasound was done. Next. Now, change the slide. Now, my question to Dr. Meenakshi is that if this patient comes as an ANC, will you report the case to the police even if she is married when she is less than 18 years near term pregnancy? And what about if she is 18 years a month old when she is 40 weeks pregnant? The next question is, can this is just be a reiterating the again same thing, what is the legal age of the consent for the sex, for the medical examination, evidence collection, and when, if any chance, she has to undergo the surgery like cesarean section, then who will be involved in the giving the consent for the surgery? Also, the what will be the who will be responsible when the custody of the children child born will be there? So, Dr. Meenakshi, please.
Meenakshi?
She's there.
ऋषि आप ले लो.
Yes, ma'am. Good afternoon, ma'am. So, child is 12-year-old. The age for consent is 18 years. So, this comes under POCSO Act. So, if this patient, this case must be reported to the police and an MLC should be made. This is very important. And for medical and forensic examination, the cutoff is age cutoff is 12 years. If a child is less than 12 years, then the consent will be taken from the guardian or parents for medical and forensic examination and sample collection. And if the child is more than 12 years, then we can take the forensic sample and medical sample for examination by the consent of the child.
And if LSCS is required, the consent.
There is another aspect.
Yeah, then if anesthesia consent is required, then if the parents are available, we'll take consent from parent or guardian. If parents or guardian both are not available, then we will, like in my hospital, what we do, 2 senior residents, 1 consultant and 1 CMO gives the opinion, because this is very important for the life of the patient. So similarly, some sort of committee can be made in the hospital who can give consent for anesthesia if the relatives are not present.
There may be a scenario when the girl presenting to you is 18 years now, but she is now 9 months pregnant. So in this case, POCSO will definitely apply, because at the time of conception, she was less than 18 years.
Yes.
So we have to inform the case to police.
Who will take the custody of the children? Hello?
In many cases, if the parents are available, then the custody can be given to the parents, but sometimes nobody is available. In that case, we consult the legal helpers and we provide shelter to the patient. Sometimes in Nirmal Chai or any other place which is attached to the hospital.
I would like to comment that usually the custody goes to the mother if till the time she is there. But the discrepancy is not that it will go to whom it will, whether it will go to mother or it will go to father. This is the basic discrepancy, because sometimes what happens, the relatives of the boy's side, they come and say that कि हम we are prepared to take the custody, and उसकी उनको लगता है कि इस चीज से उनका बच्चा उस एक्ट से भी बाहर आ जाएगा कि उसने उससे शादी कर ली है, हमने बच्चे की कस्टडी ले ली है और ये सब लीगल है. तो कस्टडी इज अ वेरी डिफिकल्ट थिंग एंड इट डिपेंड्स अपॉन द कोर्ट्स jurisdiction. We cannot decide that who is going to take the custody. It depends upon the court. Court अपने आप देख के custody decide करता है कि whichever is the best for the child, they do that.
And if no one agrees to keep the child, as Shashi has told, is given to the properly. It has to be, the child has to be adopted through proper channel, officially through adoption agency. Yes.
After proper documentation.
After proper documentation, agree.
Dr. Raj, next case. Dr. Raj, are you there?
So thank you, Dr. Sashi, Dr. Anita, and Dr. Sangeeta for highlighting the most important part which we as an obstetrician should know. The one thing is the age of the consent. So above 12, they can give the consent for the examination, for the evidence collection, and for the treatment. For the surgery, the consent has to be above the 18 year, which can be given by the guardian or for anyone, the appropriate authority from the hospital or anyone to whom the child is taken care. About the custody regarding the child born, it will depend mainly on the jurisdiction, and it will vary according to the case who is interested, and there is no question of the accused for the custody of
Not
the.
at all.
So now the next question is a female, a girl who is 15 years old, and there is a history which is the common, very common scenario in that everyone must be accounting. As I said earlier, usually the perpetrators are from the home itself only. So she was sexually assaulted by the stepfather multiple times, and the father threatened the victim कि if she discloses, she will be killed. So accidentally, what happened was the mother came to know, and then she did the UPT, and it was positive. And then the victim narrated the whole story to the mother on examination, and she was brought by the mother only. The victim was conscious, well oriented to the time, place, and person. The vitals were stable. She had changed the clothes and taken the bath after the incidents. There was no physical injury present on the examination. Per abdominally, she was pregnant, and the gestational age was 28 to 30 weeks. Now, it was a live fetus with a cephalic presentation, admitted in the ward for the investigation as antenatal care, and the ultrasound was ordered. Samples were not collected as the incidents took 7 months back. Now, the question goes to Dr. Jharna, please. Was the police informed and the MLC made? What are the medical legal implications involved in this case? What evidence collection we do at the time of the delivery of the survivor, and in case this is if she wants to continue the pregnancy, or if she doesn't want to continue, then how to go, what is the usual procedure if she wants to terminate the pregnancy according to our the MTP Act.
Thank you, Dr. Raj, and I'm happy to take this question. Was the police informed and MLC made? Now, this girl is less than 18 years old. She comes under the ambit of POCSO, and under Section 19, definitely the police should have been informed and MLC must have been made. What are the medical legal implication involved? Now, in this particular case, there are two victims, the mother and the unborn child. The medical legal implication is both for the mother and the unborn child. In case, there are different case scenarios. A, the mother wants to continue the child, there are no problems. If the mother does not want to continue this pregnancy, then she is out of the ambit of 24 weeks, even being a rape victim. And as a result, she has to, the only way possible for her is to go to the court through a writ petition. The third situation arises is if she is asked, the court may or may not allow pregnancy termination depending on the medical legal board's recommendations, the circumstantial evidence, and that she has a life. Then if she is asked to continue the pregnancy, if she goes and continues the pregnancy, if the child is born, then who takes the custody of the child? And most of the cases, the court will ask for the child to be given up for adoption if they don't want to keep the custody of the child, and that has to be done legally using the state agencies. What evidence collection you would do at the time of delivery of the survivor? Now, at the time of delivery, when she's term and she delivers, then a paternal testing is required, for which we have to take the samples in a DNA kit. We have to request the police will get it from the forensic department, and mostly it is the blood, and also because the DNA profiling of the child has to be done to match it with the father, the accused. And you have to take her blood. Sometimes you can take buccal smears. So this is what is done. Sometimes nail cuttings is also taken, but it is usually the biological one is the blood and the buccal smears. If she wants to continue the pregnancy or terminate the pregnancy, and again I said termination of pregnancy, she has to go to the court, with the petition. That is the only way that can be done.
One question again to Dr. Jharna. What about the expenses regarding the delivery and all these? Who will bear the expenses?
Yeah, the court has put across the expenses will be bared by the government or by the court. It will by the CWC also. They can come forward and bear the expenses. It is not going to be borne by the doctor. They will always help the doctor to bear the expenses, but the doctors have, supposing it is in a private nursing home, then these doctors have to apply to the CWC, telling the expenses that they have incurred, and then they will reimburse. It won't come directly. But probably for the government, but initially they release 1,000 rupees, which usually is the CWC does release 1,000 rupees. But if it is not covered by that, then you will have to get it reimbursed.
I like a comment from Dr. Gaurav Agarwal because he can highlight it very well.
Yeah, so the process is that he'll have to, the doctor who has incurred the expenses in the entire treatment and delivery process, whatever, they have to, request the court. And the court will grant the money through the channel of Government of India. So this is inbuilt in the act itself. This is a beautiful thing because for so many other things, for example, if we talk about Clinical Establishment Act, there is a order by the government that in case of a burn victim, you have to treat the victim free of charges. But it does not mention that, okay, who will bear the charge? I mean, you have to take care of the emergency first and treat the victim irrespective of whether you can claim the charges or not. So this mechanism is not built in the Clinical Establishment Act. But this is a good thing that this reimbursement process is built in within the POCSO Act. So the doctor can have, of course, it takes time, but you can claim the money and have your expenses covered.
So very well explained and highlighted by Dr. Gaurav regarding the expenses to be inbuilt in the act, which is the best part of this, one of the best part of this POCSO Act. And the second thing is that yes, every case has to be reported to the police, MLC has to be made, and the DNA paternity test has to be done at the time of the delivery, both to correlate to both, and the custody will depend upon the court jurisdiction. So, Renu, can you take over the next cases?
Yeah, the next case is this is a 16-year-old girl. It is the case of a 16-year-old girl who was a victim. She was kidnapped by 2 boys. They kidnapped her 6 months back. Both sexually assaulted her multiple times over 6 months. Physically assaulted her with iron rods and injured her. One day she escaped from the place with the help of a neighbor and contacted her father. Then they reported the case to the police. On examination, victim was well oriented to time, place and person. Her wife was stable. She had changed her clothes and took bath after the incidents because she was in custody of those boys for last 6 months. And as far as injuries are concerned, multiple bruises and laceration marks were present on both the legs. Bruise was present on left thigh. There was a bruise and laceration present on right arm and laceration of almost 4.1 centimeter present over the scalp. Genital examination, no injuries on genitalia. All samples were collected using safe kit and sent for examination. Scalp laceration was repaired and all the supportive care was given. Victim was provided with emergency contraception, STI prophylaxis and HIV prophylaxis also. Counseling was also done. So, Dr. Suman, I want to ask you, who gave the consent for examination and evidence collection? What samples were collected for medico-legal examination? What STI, HIV prophylaxis is given to the survivors and what contraception is provided?
So as the girl is more than 12 years old, she can herself give the consent for examination and evidence collection.
Yes.
And what samples were collected for medical legal examination? Because she has been kidnapped 6 months back, so we hardly find any, unless she had intercourse the previous night also. So we will try to collect all the samples as we do in routine examination of the survivor, like the vaginal swab. Maybe by chance we get the some semen there, and
Because as many as 96 days have been reported for the sperms to be alive in vagina.
Yeah.
So we should
So,
not lose
so
that
we should try to collect using the safe kit. Whatever things are there in the safe kit, that has to be used, and accordingly, all samples to be pubic hair, vaginal swabs, nail cuttings, hair, pubic hair or other hair also,
Buccal
and
seed can also be
yeah.
taken.
And because she has been, I don't know whether she is pregnant or not, but all medical samples to be sent to the hospital and medical legal samples to be given to the police to be sent to the forensic sciences laboratory. And STI prophylaxis, actually there is a this thing 72 hours is the limit when we have to give HIV prophylaxis and STI prophylaxis also. So because she has been sexually assaulted for the last 6 months, and we can send the samples for STI and HIV, and I don't think prophylaxis will be
Pregnancy
of any
case-
use in this case.
And in case she is not pregnant, then emergency contraception can also be.
If she has pregnancy test to be done, and if she is not pregnant, then we can give the emergency contraception. That is 2 tablets of levonorgestrel, 750 milligram each, or we can give 2 tablets of Mala D, and can be repeated after 12 hours. They say it can be given up to 72 hours, but can be given up to 5 days of the last intercourse.
Yes.
But,
Dr. Gaurav, your opinion?
one question. STI treatment, why can't it be given now also?
No, why it can be given? Yeah, only the
We have to
HIV.
know whether she requires it or not.
It might be required on
She
examination.
might require, depending on the
on
high risk
examination.
category. That
It shows that she requires it. That's the way
actually we
it can be given.
should give the STI treatment. It's very
Dr. Raj
simple.
is
We
saying
can give azithromycin, metrogyl, and doxycycline if she's not pregnant. But if she's pregnant, then metrogyl is to be avoided in the first trimester.
Anyways, even if she is pregnant, it has to be terminated. So
Yeah, it can be given. Yeah.
Yes, it can be.
And there is a direction from Government of India that you are doing spot test of HIV and you have to keep her under follow up. Like after 6 weeks, it has to be done, and then the survivor will be called after 6 months. So that the patient should not be left like that. She has to be in your regular follow up. You connect her to your
She will be in the window period also.
counselor.
Yeah. 6
So
months
that is
definitely she has to be examined.
Now I invite Dr. Gaurav.
Similarly for other STIs also. Some STIs may be present later on.
Yeah.
I'm not talking about this patient. So these patients need regular follow-up also. As a clinician, we must remember.
One thing I just wanted to add that previously we used to say that sperm can be retrieved up to 96 hours. But when we attended the TOT at Forensic Institute of Criminology at Rohini, then Dr. Kushwa had said that now these can be retrieved up to 1 month. And in Safdarjung already they are taking it up to 21 days. And sometimes we can take a vaginal washing also for sperm retrieval. The catheter is provided in safe kit. We insert fluid or water through that, distilled water, and then we can take that sample also. So we should leave no chance not to get any evidence. We should make every effort to get the evidence.
But this girl has been in multiple attempts. She's living with those guys.
Yeah,
That is okay. But
this is just about sperm collection.
it has not been verified for how many days after she has come from there.
This girl, I think there is a gap of 6 months, but whatever I want to say is that up to 1 month we should make effort for collecting sperm.
But it is nowhere mentioned that when did she have when she was last abused.
Yeah,
So
yeah.
hair
Yeah, maybe
follicle-
before this, before
Actually,
It's not been mentioned.
the dictum is you will collect the samples as the history of the patient. So if she is not giving any history of, like Shashi has said, definitely up to 3 weeks now we are going to collect.
Yeah.
But if he suggested that the intercourse was 2 years back or the sexual assault was 2 months back, then of course you can very well write, because the time has lapsed. There is this thing.
I would like to comment one thing, that what we are calling is that the collection for the sperms or anything. There is one thing is that when we want to see spermatozoa, that is the motile spermatozoa and non-motile spermatozoa. till 21 days, what we are talking is the genetic material of the sperm in the washings. So we are not going to see anything like sperm, whether sperm is present or not there. We are going to test the genetic or DNA material which is there in that washing or anything. So I think as per the latest 2014 guidelines and 2019 guidelines by Delhi state government, they have said that you have to collect the sample for semen till 20, sperm for 21 days. So you can extend it up to 30 days.
Yeah, exactly. This is what I wanted to say.
Okay. Dr. Gaurav, your opinion? Dr. Gaurav, I think he has not been present now.
Yeah.
I think that the case has been very well discussed as far as this lady's child is concerned. Unfortunate that she has been abused for the last 6 months, and I think the detail of examination has made it very, very clear about it. That not only she gets the immediate, as far as the samples are concerned, but the prophylactic treatment of various sexually transmitted diseases, including HIV, depending upon what the test is positive, one can get.
Ma'am, your voice is not clear.
Ma'am, can you speak little louder?
Yeah.
Can you hear me
Madam
now?
has been said.
Yes.
Can you hear me now?
Yes.
Yes.
I think discussion has been absolutely appropriate. What is the examination has to be done? What samples have to be sent? What is the aftercare of this particular patient? Everything has been discussed in this particular patient.
Okay, so we move on to the next case.
Yes.
The next case is of a 4-year-old child. She was a victim, and she was playing with a boy aged 20 years. He allegedly assaulted her physically and sexually. History of anal intercourse was present. There was no history of vaginal or oral intercourse. On examination, survivor well oriented to time, place, and person. Her vitals were stable. She had not changed clothes after the assault. Physical injuries were absent. Genital examination, no mark of injury over the perineum. External genitalia were normal limits. Anal examination showed anal tear, anterior and posterior wall. Superficial tear was present on the anus at 6 o'clock position. No perianal lesions were seen. There was no active bleeding. Treatment given was conservative treatment, prophylactic antibiotics with stitching of the anterior and posterior anal tear. Counseling was done. Samples were collected using safe kit and sent for forensic examination. What samples were collected? Who can give the consent for examination and evidence collection? What is the history-based collection of evidence? Dr. Shashi, we are repeating that over and over again, that almost all the cases require similar kind of sampling and similar kind of counseling. But Shashi, Dr. Shashi, I request you to take these questions.
Yes, sir. In this case, there is a history of anal intercourse. So it is a type, when we take evidence in these cases, it is based on history where the intercourse was done. If the patient gives a history of anal intercourse, only then we take samples from anus, otherwise we do not take. And also if the patient gives history of oral sex, then only we take the sample of inside of the mouth and gum and oral cavity, otherwise we do not take. So this is what it is being showed, being discussed here. And there is a tear here in anterior and posterior region, and this was sutured. But sometimes what happens, I've seen 5 and 6 cases in my own hospital in last 22 years that the wound is little higher. So we always have to take an opinion of the general surgeons, and sometimes it may extend up to the rectum, a lower part up to the rectum also, and in upper part. So in that cases, sometimes patients require colostomy because the anal wound which we stitch does not heal, because the stool will come keep on contaminating that area. So I have seen 4 cases in my own hospital in last 20 years. The 6-year-old child, 4-year-old child had undergone colostomy at that particular moment. So this is one of the things, and we have to always take opinion of a pediatric surgeon or a general surgeon to discuss this issue. We should not all alone as a gynecologist should not suture the anal wound. This is my opinion. This is what we do routinely practice. Second thing, this is a 4-year-old child. So regarding the antibiotic dose, it is very important that this is to be given according to per kg of body weight. So we always take opinion of pediatrician, because one big capsule of iron is a normal dose for me, but it can be a poison for a 4-year-old child. So the dose of antibiotics and analgesics and IV fluid, it must be discussed with the pediatrician and according to be given. And after initial treatment, we need a legal help in this case, and the psychological, because this is a big psychological trauma which can happen to the child. So we should take help of psychological counselors, and we should provide all type of conducive good atmosphere to the child. We have in our own hospital 2 rooms, and there is 1 room exclusively for children. And we provide them chocolates and toffees, and we keep it to a TV, and these sorts of things we keep. And one more thing I would like to discuss at this particular moment, that sometimes the children cannot tell where the assault was done. So it is better that, so we have kept 2 body charts in our OSC room, and we ask the child and to point us where the injury was done or where the assault was done. So this is one method the child can tell exactly.
Even
And
if
we should take the word of child
the
verbatim.
child to know the exact location of the act where it was done.
So body charts and dolls should be used for children, and these are the important things.
I would like to add one thing, Dr. Shashi, that in this there is no history of a vaginal intercourse and there is no external genital injury. So we might skip the taking samples from the vagina.
Yeah, madam, I think in this case we should take sample from vagina also, because child can't differentiate whether there was anal intercourse or vaginal intercourse.
But there is no external injury, and a 4-year-old child, I think if there is any vaginal intercourse, there has to be some evidence of injury.
Yes.
So I think we can think of that, because anyways she's under anesthesia. The samples must be taken under anesthesia. She has to be examined under anesthesia, because she's a 4-year-old girl who is not going to, with the tears, who is not going to allow any examination without anesthesia.
And just a practical tip, that these patients, as you have said, these patients to be seen only under anesthesia, we can make use of Thudical nasum speculum. This we have been routinely doing.
Nasal speculum.
Thudical
We can use nasal speculum to examine these.
Exactly, for example. We have been
Vagina, you can just take a swab. Do not put a speculum.
We need not to examine the vagina until unless some injuries is suspected from
But a
anal
swab
side.
can be taken. A swab can be taken. Just put in that swab stick.
No,
And
but
take
the
it.
examination will not be done by the swab.
I think
And nasal speculum will be a better option for both the examination and for taking the swab.
Okay.
So it,
when the patient is under anesthesia,
And the
I think that we should examine both the vaginal introitus and the anus.
Yes,
Over here.
Yes.
We should not miss an injury in the vagina.
Vandana ji, people have used retrovaginal
If there are
fistulae,
injuries in the vagina, will the hymen not be referred?
Yeah.
And
In
as
a
such,
4-year-old child,
law-wise, it
if
is
you
hardly
suspect
going
a
to matter.
vaginal injury, hymen will
We
be
should not miss any injury. You know, sometimes some injuries are
For
missed.
injury, we have to examine. That's what
So
I
we have to examine. I've seen one case in which there was no external injury at the level of intritus, but there was an injury at the POD. And that patient's abdomen, we opened the abdomen in the 6-year-old child, and we sutured the POD from above. And the ureter was very near to this. And we later on we used to refer these cases to pediatric
Anything
surgeon.
can happen.
So anything can happen. We should not miss any injury. We should
Because
examine.
the tissues are very delicate and the child is very small, so injuries can extend to.
And you just imagine, she's a 4-year-old child and penis diameter is so big. So it does not mean that only if she had an anal intercourse and she did not have injury at any other place. We cannot presume that. We have to examine that.
Yes.
so very well highlighted by Dr. Shashi. And the take-home message and the practical tip is to examine under anesthesia if it is a child, and take proper evidence-based collection of the samples to have the evidence properly. Then
So, the medical practitioner, private or public hospital or other medical facility, center rendering emergency medical care, they are bound to attend the child. You cannot refuse attending the child. That हमारे यहाँ तो होता नहीं है. इनको आप
No, not at all.
Treatment for cuts, bruises, injuries, etc. has to be taken care of there only, and conduct a medical examination with consent of the survivor, parent or guardian, depending on the age. That is Rule 5, Act 3 of POCSO Rules 2012. If the child or parent doesn't give consent for medical examination, provide medical treatment at least. We should not demand any legal or magisterial documentation before attending such cases. Doctor is bound to inform the police under POCSO Act. So, ma'am,
Maybe can I add something? There
just a
is
minute.
one term called trauma-informed care. Somebody had just touched upon that. There is
Yeah,
a,
pathological
there is
counseling, we
a
talked about this.
structured this thing that how it can be traumatic to the child forever throughout the life. 4-year or a 5-year-old girl. So they have to be under care of a mental health expert also. So that aspect we should not.
Yes, we have discussed about this psychological help,
Yes.
psychological counseling and help.
Ma'am, your expert comments.
My first comment is only one thing. I want to sensitize people working in a private practice that they are not used to it at all. And that's why, the literature is that, only 50% people less than 18 years are abused, and out of that 50% people are not reported.
Yes.
And that's a big crime. And that is why, after, once we had done a POCSO Act in KANOON ki PATHSHALA, I thought, it is mandatory that each one of us should see to it that, this POCSO Act reaches each and everybody. I'm glad, 60 people at the peak time had attended this particular thing. They listened to it. And then rest and depends upon them whether they want to abide by the law of the land or they do not want to abide by the law of the land. The only thing my request is to Vandana and Dr. RENU CHAWLA is to see to it that, we buy 2 kits and make it available so everybody knows, where it is available.
Yes, ma'am.
And the badly managed case of child injury, 4-year-old child injury may lead to formation of rectovaginal fistula, VVF and many other complications. So we have to be very,
very careful.
Very, very careful.
And majority of the time, because it comes from the house, that, my mother may like to shy it off, everything may be like this, but if you have a strong suspicion, you have to inform the police. You have to inform the police. That's it.
Yes.
That's to be done by you. Because in case if you've not done it last time, Dr. Gaurav had spoken about it, that a couple of pediatricians have not informed the police and they are facing the consequences subsequently.
Yes. So we come to the last case for today. This is a girl, 8 years old. She was brought by her parents on 21st of December 2018 with the help of an NGO worker. The history suggests that the girl was taken by her cousin sister to Gujarat for studying. Parents, being poor, could not afford. When even after calling the girl back many times, the cousin did not respond. Parents felt something fishy. Father then went there, and when he brought the girl back to Delhi on 4/12/18, she was not in a good state of mind. Parents noticed multiple burn marks were present on her body. On much asking, she told her mother that she was made to do all household chores and was physically and sexually abused multiple times by her brother-in-law with the help of her cousin. Whenever she refused, she was injured with hot chimta and knife. She told her mother that she had multiple episodes of bleeding, per vaginal or per rectal. It was unfortunate that despite going to many police stations, the father was not able to lodge a complaint. The NGO man noticed her father in distress and brought them to hospital. On examination, she was conscious, oriented to time, place and person. Multiple healed burn marks over various parts of the body and in perianal region were present. No fresh vaginal or rectal bleeding or local injuries were observed. When police information sent on 100, they readily responded and sent the local police with female inspector officer, investigating officer. Even they were not initially willing to register the case, as they said that incidents happened not happened in their jurisdiction. However, much persistence, they agreed to make an MLC. What is zero FIR? What is abetment of a crime? Who can bring the survivor and where can the survivor be initially taken? What is the disadvantage of reporting and registering the case so late? Dr. Anita, I want you to answer all these questions.
Thank you, Renuji. This was a real life case which we had handled at Sardar Vallabhbhai Patel Hospital. So regarding zero FIR. Zero FIR is it's not like other FIR which is given a particular number. In zero FIR, whenever the crime is reported, the FIR is lodged there. It is given zero number because they might say that it did not happen in my jurisdiction. So after case, this Justice Verma had given this order that anybody can report any crime to anywhere, whether it is in their jurisdiction or not. The FIR will be given number zero, and then the proper referral of that case will be done to the concerned police station, where a proper FIR will be lodged and the number will be given. So that is the importance of zero FIR, and you can insist. Like initially, our police was also not willing. They said that this happened in Gujarat and all that. But after much insistence and showing them the rules, they lodged the zero FIR, and then they referred the patient to other concerned police where the jurisdiction was there. Regarding abatement of crime, what is abatement of crime? Abatement of crime is you are not committing crime yourself, you are facilitating the other person to commit the crime. You are a party to it. You have facilitated the crime to happen, or you are a part of the conspiracy. So all these things mean abatement of crime, and abatement of crime has different set of punishments. It can be one person or it can be multiple person who are involved in this particular abatement of crime. Now, regarding who can bring the survivor and where can the survivor be initially taken? Anybody can bring the survivor, even if you have slightest doubt that this might happen. Even then, you can inform the police. Any bystander who has come to have the cognizance of the crime, they can report it to the police. Any neighbor, parents, or the child may be even taken to child welfare committees or other NGOs, and NGOs might help them to lodge the complaint. Or what can happen is the survivor might come directly to you, to the hospital, to seek help. Then you have to follow the same procedure. You have to inform the police, and all the procedure is followed. Now, what is the disadvantage of reporting and registering the case so late? We have already discussed much about it. If the survivor is coming too late, then the evidence collection will be very poor, and we will not have concrete evidence against the culprit. So that is important, and moreover, the child or the girl or the boy, whoever is the survivor, might have been neglected regarding her clinical treatment or management is concerned. Sometimes the things may take a serious turn, like if she kept on bleeding, or if she had, as she has also highlighted, we have seen even fistulae forming because the timely treatment was not sought by the patient. So all these things are important. With the patient, as soon as the survivor comes, it is prudent that we should collect evidence as early as possible to have a very good evidence against these things are very, very important.
So we should take pictures of the private parts. If some injuries are there or some marks are there, they should be photographs should be taken. And
yes. If you have got a camera, then
point of time we are not going to
photograph,
get
you have to take a separate consent.
Yeah.
Hello?
Even if required, we can put a toluidine dye and can see the bruises better, and then we can make use of colposcope also, or Polaroid camera, and good camera can be used for evidences.
Yes.
But for photography, we have to take a separate consent.
The consent we have already taken now for forensic material and for
consent for examination involves both. This thing.
Yeah, consent for forensic sample collection, I think that will suffice.
Nice. So in conclusion, a pregnant minor girl married or
Comment from
Madam
you.
wants to say.
No, I can say that this particular session has been great, especially from the point of view of private practitioners. At least they definitely go informed.
So to conclude, pregnant minor girl, married or unmarried, is considered a victim of sexual assault. Under POCSO Act, minor girl that is less than 18 years is unable to consent to sexual intercourse. Make MLC, that is medical legal case, report to appropriate authorities and take receiving. If knowingly fails to make this report, can be punished. Don't insist to file FIR. Informed refusal must be documented.
I would like to add two things. One thing is that with respect, they are no more called the victims of sexual assault. We call them survivors of sexual assault because they have crossed all the barriers to have and shown their courage to come to us. So they are called survivors of sexual assault. And second thing, these patients cannot be refused. These patients can come through a court. These patients can come through police. These patients can come through FIR, or they come directly. In all circumstances, we have to attend them.
Yes. According to National Commission of Child Rights, providing MLC to authorities is sufficient on our part to comply with the reporting requirements of the POCSO Act. MLC and FIR are different.
And RENU, there is one more thing. If suppose in a particular case, two acts are applicable, POCSO Act will prevail on. If even any other, suppose there is something like where two acts are applicable, so POCSO will be given, the same preference over other acts. There are certain circumstances patient will say, don't tell anything. Then the clinician gets worried whether it will be, interfering by the thing against, public or against the privacy of the patient. But POCSO prevails over other acts. So
Very important,
POCSO,
very important.
it empowers you. POCSO empowers you that way.
Yes. So POCSO Act provides equal security to male and female children. So, this chart, from this chart we can see that offences committed and the punishments. So rape of a girl who's less than 12 years, the punishment is death sentence. Rape of a girl less than 16 years of age, minimum punishment is 10 years and maximum is 20 years. If a person uses his private part against a body of a child, considered a serious crime, and 7 years to life imprisonment may be given to him. If a person touches the private part of a minor or forces a minor to touch their private part, considered as a serious crime under Section 8, and the sentence is 3 to 5 years. If a person does any kind of sexual act in front of a minor or forces a minor into doing any kind of sexual act or forces the minor to watch pornography, minimum of 3 years of imprisonment and to a maximum of life imprisonment. Failure of adult to report a case of child sexual abuse may be imprisoned up to 6 months.
Very informative slide.
Rape is indication for termination of pregnancy. Protocols for MTP are to be followed, like consent, whosoever is eligible for consent, like the patient herself or the guardian. Then the police ask the police to collect DNA kit from forensic lab and bring it to the hospital at the time of MTP. DNA kit to collect blood sample of survivor and fill the forms and the product of conception should be collected as I have already specified. They should be washed with saline and collected in a wide mouth bottle, and it should have a lid. It should be covered properly and labeled properly and handed over to the police personnel whosoever has been assigned for this work. So thank you. With this we end.
Thank you, Dr. Renu.